Hello, my name is Guy Lemunyan, and I've been working in the addiction field since 1975. I've worked in detox facilities, rehab facilities, and done program management, including inpatient, outpatient, and community settings. This talk is about dry drunks and dry benders. The original name for this phenomena was cited by Bill Wilson in a 1954 letter, and he called it a dry bender. Actually, Bill is describing his depression, which was lifelong. Bill was depressed before he ever had his first drink. And of course, he also described being angry about it, anger being a symptom of depression. By 1953, clients at a rehab facility in Delaware called Governor Bacon Health Center were telling staff there that they were experiencing these dry drunks. And the staff there decided to do a little research and find out what actually that meant. So they studied what they could. 52 members of Alcoholics Anonymous answered questionnaires. And they found that dry drunks are experienced by most alcoholics who maintain sobriety over a long period. They found other information like the occupation of the drinker has no statistical significance about maintaining their sobriety, and the drinkers usually drink 10 to 20 years before they begin to maintain sobriety. They also found that dry drunks generally occur within the first year of sobriety and more occasionally in the early months. And actually, this sounds like what we now call post acute withdrawal symptoms or pause. They also found that these are irregular and diminishing in intensity as the length of sobriety goes on. Like Bill, they report feelings of deep depression and frustration and indecision regarding taking a drink. They also report that inner life is largely responsible for precipitating the dry drunk event, what we currently call triggers or activating events. The dry drunk is often preceded by similar feelings, which in the Terry Gorski 37 relapse warning signs are described well, and in the BUD or BUDS, building up to drink syndrome. And they feel relieved after a period of this dry drunk. And during that time, they did not use drugs to try to combat or cope with the dry drunk. I think if this survey were done again, they would find out there was much more drug use, alternative drug use going on, because many of the compounds that we use now had not even been invented in 1954. Other symptoms include irritability, restless, and impatience. After these events, thoughts, feelings, and behavior return to normal. And they have found that the person most helpful during this is other drinkers, which they found in Alcoholics Anonymous. Again, this is a limited study. And the I thought was that Alcoholics Anonymous was preventative to keep people from having dry drunks. However, most people had them. And they also felt that dry drunks are related to mood swings, which is in epsilon alcoholism, according to Jelnick. They didn't find that financial status was improved in sobriety. That's common. And that the researchers said it also sounds like late withdrawal symptoms by another doctor during this was researching during the same time, and we'll talk about that next. And in this study of 52 people, they found that rarely do dry drunks result in a relapse. Just mentioned was another publication by Marvin Wellman, a a doctor in Canada, and this is not research, but his personal observations. And he called this late symptoms of alcohol withdrawal. And he said that uh, they describe this as stinking thinking, which has come from the 12-step world, and describe more severe episodes as dry drunks. And he found the symptoms again are irritability, depression, insomnia, is difficulty sleeping, fatigue and restlessness, aloneness, and easy distractibility. And these also sound like the post-acute withdrawal symptoms. And he put these into time periods occurring mostly during the first 6 months, still occurring during the second 6 months, less so in the third 6 months, and reducing after that, but continuing in some lifelong. His summary was that primary drinking versus secondary drinking and simple addiction to alcohol were potential causes, and that late withdrawal symptoms follow the development of repeated blackouts and occasional evidence of intolerance of alcohol. He's really describing what is called, late stage drinking. Early stage drinkers don't have blackouts and don't have physical damage. And he again reported that the late withdrawal symptoms began a few days to a few weeks following the primary withdrawal symptoms, and talks about the first 6 month period. The symptoms again reported earlier: irritability, depression, insomnia, fatigue, restlessness, aloneness, and distractibility, and may be accompanied by physical symptoms, and that he is hopeful, being a physician, that physicians could assist in that. The reference most commonly cited currently was first published in 1970, written by an addiction counselor called Solberg. Solberg's claim to fame was he was a speaker in Alcoholics Anonymous and became a counselor for the 12-step oriented facility Hazelden. And he said that his observations were traits of character defect, that is, grandiosity, judgmentalism, intolerance, impulsivity, and indecisiveness, which he felt led to mood swings, inability to demonstrate emotions, that's emotional blunting, and a positive symptom, introspection, to ask, where is this coming from? A feeling of detachment and self-absorption, which he described as narcissism. He also said there was an inability to appreciate or enjoy activities, disorganization, nostalgia, thinking about the good old days, romanticism, again, thinking about the good old days, and escapism, that is, fantasizing. And these also are found in the Gorski 37 relapse warning signs, and the BUD or BUDS, building up to drink syndrome. In summary, he said this caused the absence of favorable changes in attitude and behavior and discomfort in life, with the symptoms of discomfort, denial, self-deception, rationalizing, focusing on others, projecting, overreaction, resentments, frustration, and anger, and does say that families should get help in counseling centers or Al-Anon or the AA sponsor or from County Human Services. The corrective measures or the cure, however, are non-medical, non-psychiatric. It's to develop humility and a power greater themselves, which is manifested by the Alcoholics Anonymous program. And ego deflation, a goal of early Alcoholics Anonymous, and to increase AA involvement. By 1980, another concept has emerged called toximolecular interpretation. And this chart shows the similarities between the dry drunk symptoms and symptoms of hypoglycemia. Also, during this time, the idea of megavitamin therapy for addictions had developed. Bill Wilson himself became a fan of megavitamin therapy, in particular niacin therapy, which he reported cured his lifelong depression. Also during this time, Bill Wilson experimented with LSD, and looking backward, his hot flash or white light experience that he experienced in 1933 in Towns Hospital was potentially caused by high doses of the potentially hallucinogen belladonna, strychnine. The treatment also included morphine, formaldehyde, and chlorohydrate, and older sleeping medication, and cathartics followed by castor oil. By 1985, the dry drunk syndrome is being cited out of the USA, in this case in India, using same or similar symptomatology. In summary, the dry drunk syndrome began as Bill's description of his depression and anger as dry benders. This syndrome is not recognized by medical professionals outside the 12-step addiction treatment arena. And Solberg, the author of the Hazelden 1970 mostly cited pamphlet, had no healthcare credentials, and this syndrome is not cited in the DSM-5, or that's a Diagnostic and Statistical Manual of the American Psychiatric Association, nor the ICD, the International Classification of Diseases. Also, this may be a reemergence of symptoms suppressed by alcohol. We talk about self-medication. Some people say that when they drink, they feel normal, that it's treated something that has been wrong with them. There is no agreement as to the causes of this syndrome, and no agreement as to its symptoms. And I'm reminded of the attempt to get codependency into the Diagnostic and Statistical Manual with 100 symptoms. And the response was, there are so many symptoms that even normal people could be said to have codependency. And again, many or some of these symptoms are also recognized as the post-acute withdrawal symptoms, the relapse warning signs, Terry Gorski's 37 relapse warning signs, or BUDS, the building up to drink syndrome. So I hope this has been helpful for you. Here's my contact information. Peace and love to all.